FACES stands for Foreign Adoption Clinic and Educational Services. The FACES program is a program I started in 1999. Prior to 1999, I was in private practice, and that's when I adopted 2 children from China. My first son was 14 months but was developmentally delayed, and he had lots of issues that made me realize that children coming from orphanages have some very different needs than children who need primary care in St. Louis. So that started me working with different families who had adopted internationally, and over the course of about 3 years, I wanted to develop a clinic. The vision was to provide a clinic that could provide a comprehensive evaluation to look for growth and nutritional deficiencies, infectious disease, developmental and mental health issues, and to make sure that they're getting addressed. I broadened the clinic to include a comprehensive evaluation for newly arriving refugees, as well as refugee children that are being born into newly arrived refugees. The main pre-placement services is just to review medical records for families. Sometimes they get videos, sometimes they get pictures, sometimes they'll get a lot of medical data. It's just whatever medical information they have available, I'll look at and I'll try to piece together, number 1, what are the medical conditions? Number 2, how are they growing? How are they developing? How might this medical condition or lack of care for this medical condition have impacted how they're thriving in the orphanage? And it can try to help families prepare for whether a child may have more significant emotional developmental needs, or whether a child is likely to come and do fine. But it tries to identify more the high-risk children, just so parents can prepare. The aim of the medical record review is never to tell a parent that a child's not adoptable. All children are worthy of being adopted. It's just families need to be appropriately prepared for the issues. The post-placement, the first service is the comprehensive initial evaluation when they arrive into the United States. And I like to do that about 2 weeks after arrival. Gives parents a little bit of time to know them, but then it also helps us identify things early if things need to be addressed, and get them into appropriate subspecialists. Then we also do neurodevelopmental evaluations, which includes just looking at their development, their attachment, behavioral issues. The areas where they tend to really struggle long-term is in social-emotional development. They're very immature for their age. They're very much behind their peers. And as they start getting into grade schools, they appreciate those differences, and that can even widen the gap, so to speak. Many kids that I have seen will go to what I'd call mainstream psychiatry, and they can often be, I think, misdiagnosed. And I think attachment issues present in much different ways. Sometimes it's more that the parent needs to be worked with just to approach this in a different manner, and sometimes it's that the children, need a lot of intervention or have diagnoses like fetal alcohol syndrome, or we've diagnosed Fragile X and other chromosome disorders that impact their development. I spend a lot of time with patients. I think that's one of the strengths, is I think really to understand what is challenging the family, what is keeping the child from integrating well into the family or into school. I just need to sit down and listen and see what the problems are.